like looking back, like I wasn't sort of aware of this in like 2017, 2018, 2019, when I was like first experimenting with altered states of consciousness. But like looking back, I think the advice that I would give myself is to try and like let go of any expectations of like let go of any framing, that any assumed understanding of like the nature of your problem, because like one sort of defining feature of my psychedelic experiences is that they're surprising, and that like they sort of often served to like undermine my assumptions rather than confirm them. And I think you know, like why this phrase traumadelic that you coined is like so helpful is that like it captures so much about like I think the kind of the way that sort of like budding psychonauts are like channeled into this like way of understanding their suffering.
Rose Cartwright, thanks for coming on the podcast.
Thanks for having me, Brian. I'm very excited to talk to you.
Oh, nice. Yeah, I don't know if you got familiar with any of my work. I just put out a book recently called Traumadelic, and it's a kind of a critical look at the whole psychedelic psychotherapy movement. And
uh
I had Bruce Levine on a couple times. He's a writer in the critical psychiatry movement, and so I do a lot of this like kind of critical look at things, and a
hmm
lot of the people I have on the podcast are, experts in the field and practitioners. But I was thinking this morning, I think maybe you're the first person who has just kind of like that first person experience of what it's like to go into the mental health world and then into the alternative healing world. So
hmm
I'm excited to talk with you and to share this with my audience. I think it'll be quite revealing and refreshing.
Amazing. Yeah, no, I'm excited too.
Cool. Well, I know you're probably better known in the UK, where your first memoir, Pure, was made into a TV adaptation on BBC Channel 4, and you did a lot of media appearances there. But for people maybe on this side of the world who
hmm
aren't familiar with your work already, if we could just start a little bit by like where the journey started for you that you outline in that first book, Pure.
Sure, yeah. So, well, maybe I should go a little further back than that and talk about like what led me to write the book in the first place. And
Mm,
really, it all stemmed from growing up with quite serious mental health problems. I grew up in the Midlands in the UK, and when I was about 15 years old, I started experiencing very distressing, intrusive thoughts about sex and violence that I didn't understand and that I was very ashamed of. And and when I say intrusive, I mean like, you know, hundreds of times a day, extremely graphic, accompanied by an incredible amount of anxiety. I was very ashamed of the thoughts. I didn't tell anybody about them. And what I didn't know at the time and what I wouldn't figure out for a few more years until I was in my early 20s is that these are quite common experiences for people with serious mental health problems. And that one way to conceptualize the experience of repetitive intrusive thoughts and compulsive attempts to get rid of them is to say that you have OCD, obsessive compulsive disorder. And that was really the kind of when I learned that intrusive thoughts were a, in quote, symptom of OCD, that was really a kind of watershed moment for me in my early 20s when I was like, oh my God, I'm not alone. I have a diagnosis. I'm not a freak. There's nothing, I haven't done anything wrong. I just have this illness, and I have an explanation for my experiences now. And I decided to write about those experiences when I was about 27. Um, Firstly, in the form of a big feature article I wrote for The Guardian here in the UK. And at that point, intrusive thoughts, especially sort of taboo intrusive thoughts about sex and violence, hadn't really been spoken about much in public in the context of OCD. And what happened off the back of that article is I think it lifted the lid on a lot of people's like secret shameful experiences, and I was sort of propelled to kind of mental health advocate status in the OCD community. And the book Pure was a sort of expansion on that article. So it was a memoir about my experiences of OCD and intrusive thoughts. And yeah, it seemed to really speak to people who had been through something similar. And it had this kind of snowball effect, because the book then got turned, as you say, into the 6-part drama series for Channel 4. And it was a very exciting time in my life. It was very nerve-wracking. It was cool to be able to raise awareness on something that hadn't really been spoken about before. And yeah, that's the sort of backstory. And then some things changed for me, some things stayed the same. But yeah, we can
Hmm.
talk about my next project, I guess.
Yeah. Well, I'm also curious, like, what was that like for you to become so well known for something so kind of personal and intimate that had, previously a lot of shame wrapped around it? I mean, that
Hmm.
must have been a very strange and weird experience to some degree.
Um, It was strange, I guess. I mean, I've because of what I've been through, like there's been a lot of weirdness and strangeness in my life. That a lot of that strangeness has been shameful and secret, but then this was the kind of strangeness and weirdness that connected me to other people. So actually it was a really beautiful thing. And also, this was like terrestrial TV, so the show was going out at the same time every week. It was quite a unifying thing, knowing that
Mm.
like everyone I knew and loved was like watching it at the same time every week. Um, and yeah, I got so many wonderful letters from people in the OCD community who'd felt moved by the mainstreaming of this subject matter. So it was yeah, it was cool. It was mainly cool.
Yeah. How was it though, like, to keep talking about these experiences in public with so many people listening and watching?
Um,
Did it feel therapeutic, or did you ever
it
feel
did feel
like,
it.
yeah,
Yeah, I mean, it's sort of like, the first book and with my second book, like it's that certain media are more productive, I think, for talking about this stuff, and like newspaper articles and like I did a bit of live news and things like that, where you have very short segments, or like your work is getting edited by someone else for a certain audience. It can be quite frustrating in those media, because what comes out the other end is the most sort of uh reductive form of your story. So
mm,
I always really enjoy doing podcasts like this, because you get to like waffle on for an hour or two, whereas it was quite I found with Pure, even when I tried to bring in um more context to what I'd been through, uh, what came out the other end was often just a very basic description of, I was a girl with OCD and I had this illness, and these were the steps that I took to get rid of those symptoms. And it became like a kind of a redemption story, kind of got shaped beyond my control, if that makes sense, by editorial processes.
right.
Um,
They wanted to kind of
yeah.
paint you as this heroic figure, right?
Sure, yeah. I got put on a pedestal in a big way. So, and I did, that's not the kind of thing, I was in my 20s at the time. You don't really, wasn't really aware of what was going on. It's only in retrospect where I'm like, yeah, I guess I was sort of made into something.
Yeah.
Um, but, also having work, that's the nature of having work out in the world, is that you don't always have control over how you're perceived or how your story is retold.
Yeah, that's for sure.
Mm.
So at some point you s- I mean, what you were doing stopped working for you,
Hmm.
right? And you started to question the diagnosis and diagnoses in general. Can you talk about that
Sure, yeah.
moment when things started to kind of change for you in your view of it?
Yeah, well, the sort of in the latter half of Pure, I write about how like I went through like cognitive behavioral therapy, and it had a massive positive impact on my mental health. And certainly my mental health was better at the end of writing that book than it was at the beginning. And I think I chalked it up to the fact that I'd had cognitive behavioral therapy. And therefore I thought, okay, this is the protocol that gets rid of the symptoms that I had. In retrospect, well, when a couple of years later I had another massive relapse and I started self-harming again and I felt suicidal again, and I realized, like, after I'd told this like grand redemption story that at that point was like on the way to becoming a TV show and to growing even bigger, I sort of realized that the kind of the what I thought had worked actually hadn't worked. And I started to reflect that, you know, perhaps it wasn't the CBT itself that had been therapeutic back then. Perhaps it had been the fact that I'd built a really trusting relationship with another human being through therapy, or perhaps it was the fact that I'd already started writing about my experiences that was the therapeutic thing. So I had this weird
Mm.
experience of thinking something had worked. And then when that crutch was taken away and I finished therapy, I was like, oh fuck, I'm still like, I still feel like I'm dying all the time. And what have I done? And then it was a case of kind of going back to the drawing board and trying to figure out like what works.
Hmm. Can
Yeah.
you talk a little bit about like the CBT and how it was applied to your particular case? Like how you were taught to deal with the thoughts?
Yeah, so it was a kind of classic sort of, they call it exposure and response prevention therapy, which is a kind of cognitive behavioral therapy, um, whereby, so my obsessive themes over the years has varied quite a lot. Um, the main theme during my teens and 20s was like intrusive thoughts about sex that were not fantasies, they were very much unwanted. And yet they caused me to ruminate endlessly about my sexual identity. I was like, well, if I'm thinking about XYZ
Mm,
thing, it must mean I desire it. Just completely getting lost in rumination. And the exposure and response prevention therapy approach is basically to expose a patient to anxiety inducing material until you get a kind of extinction response, i.e., you stop feeling anxious to something that had previously made you anxious. So I
mm,
guess it's, well, you'll know more about this than me with your therapeutic training, but that sort of anxiety will eventually like burn out
mm,
the more you expose someone to this to it to the source of the anxiety. um yeah, so that's in a nutshell, and I think it helps that I really believed that it worked. That was a very
mm.
powerful factor. um
So it becomes a
yeah.
kind of a ritual in that way. I mean, if you take you know, my perspective on it would be, well, you're performing a kind of ritual. There's a faith
Mm.
that this thing is going to work, and it's maybe not the technique itself.
Sure, exactly. And also, you know, you're doing it, you're in quite a complex relationship with this a therapy figure as well, the therapist. So like you're
Mm,
doing it because like you know, people with OCD tend to be like often like very sensitive people who are eager to please. And like I wanted to do the right thing by my therapist and I wanted to be diligent and I wanted to do the work. So all of that is like incentives to like throw yourself into a process, and I really did. And yeah, as I say, I had thought that it had like put my problems to bed, and it ultimately didn't.
hmm. And there's also a revelation for you. I think you met a researcher at some point, and she told you
Mm.
that there's actually no kind of biological basis for most diagnoses.
Yeah, so there was like a couple of there were like a couple of like catalysts in my journey that caused me to like change the way that I frame my mental health problems. You know, when I wrote Pure, I wrote and spoke about it like it was a disease with a biological root cause, and that it was kind of isolated from the context of my life, because that was the kind of mainstream narrative around mental illness in the UK and I'm sure in the US at the time. Um, I just, yeah, my experiences with symptoms of an illness, and that any therapy or medication you have like treats those symptoms. And that started to change for me. As you say, one of the catalysts was when I was doing a podcast about mental health, and I went to Trinity College Dublin to interview a professor there called Dr. Claire Gillen. And she was the first person that ever really explained to me that the phrase that she used was that OCD is not a biological reality. And what that means is that it doesn't mean that there's nothing going on in the brains of people with OCD. Like, obviously, like, you know, everything we do like shows up in our brain. That's the nature of being a biological being. What it means is that there's nothing like that. Someone with OCD doesn't necessarily have in common the same like biological, in quotes, malfunction as another person with OCD, and that there's no biological signatures that people with OCD have in common versus people with other diagnoses like depression or eating disorders. Basically, that there's no biological underpinnings to justify like these discrete diagnostic psychiatric categories. And that was like, my mind was blown by that. I didn't know that. I thought, you know, there was this common phrase in advocacy when I was growing up that mental illness is an illness like any other. You know, I thought that this was like had been proven to be a pathology of the brain in the same way that, you know, tuberculosis is pathology. And when I found out that that wasn't the case, I felt quite disillusioned with some of the stories that I'd been told, or how I'd been led to frame my mental health problems by the advocacy space and by mental health professionals. Yeah.
Hmm. Yeah, you've talked about like how getting a diagnosis can be a relief in some ways and kind of help normalize your experience, which helps with the shame and all of that, right? And the feeling of
Mm-hmm.
isolation. But what are some of the limitations of the diagnosis as a story and how people can tend to identify with it?
Well, I think diagnosis can have a place. I think, as you say, it helps people. It offers relief. It helps people connect to others who have been through something similar. I think there's a problem in the way that that diagnoses are given. I think it can be you know, it's not, these are not given as like woolly constructs, which is what they are. They're given as like explanations of the problem. It's like, you are suffering because you have OCD. Whereas, and I think the implicit message in that is like, look no further. Like, you've arrived at the
Right.
explanation for your problem. And that is very comforting. But it's also it can be quite myopic, because of course, like, all you're really doing is describing something that you already know is there. Like, you know, phenomenologically, you know what it's like to have OCD because you're living it every day. Giving it a label and saying this is something that other people experience, helpful to some extent, but also limiting if you think that that's going to solve your problem, which is what I thought, and it didn't.
Mm-hmm. Yeah. And I guess with yeah, I mean, the way that I've been trained to look at diagnoses is that it's a working hypothesis
Mm,
that you're exploring with the client rather than this, you know, reductive cause and effect type thing.
mhm.
And I guess in some cases that's not the way it's handled, that it is seen as well. We've got the explanation and then we've got the prescribed treatments for that.
Yeah, exactly. And I think diagnoses are helpful for like the psychiatric industry, because they sort of like give the illusion of like targeted treatments for like specific conditions, whereas like a lot of the specificity is kind of pseudo. It's like, you know, actually, you know, the brain of someone with OCD might have much more in common with someone with another diagnosis than another person with OCD. So I think it can be a helpful way of navigating, and diagnosis can be helpful depending on how it's used by clinicians. But I think broadly, you know, we've seen explosions of rates of diagnosis of ADHD. I think a lot of people think when they're given that diagnosis that means that they've like that they've discovered like a specific pathology in their brain that is ADHD. And obviously, like, you know, we don't have the evidence to support that. It's a construct that can be helpful and limiting at the same time.
Hmm. In your journey, did you do any research into the DSM?
Yeah, a lot of research into the DSM. Yeah, and sort of learning about it sort of came like further down the line for me in my journey. But like learning about the history of the DSM, like I thought that the DSM was kind of was canon, was gospel, and I sort of assumed guess I'd never really interrogated it because it was just received wisdom, but I had
Hmm.
assumed that the DSM must have been the result of like research into like neuroscience and brain scans. And when I found out that it was actually just like a group of people like sitting around a table talking about like clusters of symptoms, it sort of, I kind of realized that it was actually a much more subjective document than, yeah, that it was essentially very subjective rather than based in scientific research, which was astonishing to me because it's such a
Hmm.
powerful, it's such an influential document. And, you
Yeah.
know, they call it the Bible, right?
Yeah.
um, so, yeah,
Yeah, I mean, a lot of people don't know that it's like 10 or 12 people sitting around a table kind of hashing things out and going, well, and they come up with these diagnoses and there's maybe a consensus on it, but then the next edition comes out and things have changed, a lot of things have been added, some things have been taken out. So it's
yeah.
always in revision. So it's not like a
It's
Bible.
always in revision. Sure, exactly. Yeah, I think you know, even I think because it's something that we inherit, you know, it's the kind of the water that we swim in that we don't look at. Like even I think clinicians are not like reading the DSM in fine detail, and a lot of,
Hmm.
you know, I'm sure we're going to talk about psychedelics, like, you know, psychedelic research, a lot of psychedelic research just sort of takes um diagnoses as like meaningful scientific categories, and I think that's kind of an error because it's yeah, I'd encourage any listener to go and do some research around the creation of the DSM because it's kind of shocking, really.
Yeah, I know. Once you start, like you said, it's just like received wisdom by these, I don't know, like unknown authorities, but everybody is referencing this thing and pointing to it. But once you start questioning it, you just go, well, wait, who came up with this thing? And you
Sure,
start
yeah.
to read some articles on it. You're like, oh my God. And then even
Mm.
people who are involved in some of these editions have come out later and said, look, it's kind of like guesswork, or we're just kind of coming up with things that fit, but
Mm-hmm.
it's all kind of provisional. And but the way that it's put out there is so authoritative and so definitive that
Yeah.
as lay people, you just go, well, it must be true. I mean, this must be the latest kind of research.
Yeah, exactly. But and also there has been attempts like since the first editions, there obviously has been attempts to like go and search for the biomarkers that support diagnostic categories, and that research has turned out almost nothing over like, you know, billions of dollars spent 4 decades of research, and you know we still haven't found those biological differences between people with different diagnoses. So um yeah, all of this was like super fascinating to me when I first learned about it, but also, you know, distressing and disillusioning.
Yeah, right. Now you're associated with this whole mental health movement and the
Yeah.
the kind of like biological basis for mental health disease and all of that.
Hmm.
And you're kind of your world's getting blown apart here.
Sure,
Um,
exactly, yeah.
But like you didn't double down on it. You just continued to explore, and that led you into these alternative modes of, well, let's just call them therapy, but it included things like meditation as well as
Hmm.
psychedelics, right?
Yeah, sure. I mean, like, you know, there was no way that I could double down. Like, I kind of, that trip to Dublin when I spoke to that professor who gave me that really helpful information, like it was a real I was really faced with my own cognitive dissonance because like it like when she said that OCD isn't a biological reality, it was like at first it was I was wounded by that. I was like, what? I was offended actually. You know, I was like, what do you mean? What the
Mm,
fuck are you talking about? What do you like? It was like you know, I just like she just punched me. And that's because like being an OCD advocate and like the idea that I had this disease, and that I was in this kind of like kin group with everyone else that had the same disease, like that had become part of my identity, and it felt like an attack on my identity. Um, and yeah, when that sort of like when I actually started to do the reading and I realized that, you know, what she'd said to me was not an anomaly, it was actually like not even controversial. Like this is known in psychiatry, like psychiatrists know that there's very flimsy biological underpinnings of diagnoses, you know, that then became unignorable. And then the question for me now is like, well, what does this mean for me and my suffering?
hmm.
because I was like, my life was like, my quality of life was just shockingly poor. Um, I was back to self-harming again. I didn't want to be here. I still had all the intrusive thoughts I'd had when, 15 years prior to that. So it was a case of what next. And one of the first avenues I explored, as you say, was meditation, which was another catalyzing experience for me, because I had my first altered state of consciousness was on a meditation retreat in 2017,
Yeah,
which
but
blew my mind.
well, just to say, I'm kind of amazed because, like, for someone with the kind of extreme intrusive thoughts that you had, the idea of going and sitting on a cushion to be with your thoughts for, I don't know, 4 hours, 10 hours, whatever the retreat was
Yeah,
a day, that sounds like a little terrifying. Were you scared to go
horrendous,
into that?
terrified, yeah, horrendous. But like, when I imagine that a lot of your listeners know what it's like to have mental health problems, and like they know what it's like to suffer in your mind. Like, it can get to the point where, like, you'll walk through fire to find your salvation. Like, I had nothing to lose. Like, the idea of living life the way I felt, like forever, like to not improve, that was, I couldn't.
Mm.
So um I was willing to try anything, and I thought, well, let's just go and sit in silence for 10 days and see what emerges. Uh,
Wow.
and yeah, the first 3 days were just pure hell. Like, it created an escalation in the intensity of my thoughts, to sort of, and well, one thing that I learned very quickly on that first retreat was that, like, it's almost impossible for me to be in touch with the sensations in my body.
Hmm.
I didn't know that before, but that like, actually, not it, that it was emotional agony to sit there and to feel what I was feeling, and that these thoughts were trying to drag me away from those feelings. So that was a very quick insight, and they call
Mm.
it insight meditation for a reason. um so that astonished me quite quickly. And then, after 3 days of this, something in my psyche stopped battling. And I kind of, sometimes in Buddhist practice, they talk about like clicking down through layers of alignment. I kind of clicked down into a place of increased stillness, and entered what I can only describe as like a full-blown psychedelic trip. A sort of unbroken field of non-duality opened out for me when I was sat on the meditation cushion, where there was no mediation between the sensation and a sense of a person feeling the sensation. I was just pure sensation.
Yeah.
And I saw white lights. I had a sense of like being a field of expanding love that was just growing and growing and growing, moving out into the universe, and also coming back at me from the universe. Um, it was, yeah, bearing in mind that, I was a fidgety skeptic, and I had no spiritual practice at the time. I was blindsided by that. I didn't know what to make of it. It lasted over an hour and a half. I was just like weeping tears of joy whilst this was happening. And when I came to, um, I sort of, what was most astonishing to me is that that was the first time in however many years, 15 years, where I hadn't had any intrusive thoughts. I hadn't had any thoughts at all. I hadn't even had a sense of being me. And that was another one of those moments of just like inching the door open, and sort of realizing that the paradigm that I've been living in was perhaps limiting me, and that, if illness is the right way of thinking about my suffering, then like, how could it be that my illness was just spontaneously cured and completely disappeared for 90 minutes like that? It was a clash of paradigms. And
Hmm.
yeah, that was sort of really the start of a kind of different way of seeing.
Yeah, well, it's an interesting experience, like from my perspective. Um, the way that I hear that and my take on it is that, thought will burn itself out at some point, and then you're
Hmm.
left with, like you said, the pure sensation. without any intermediary, any kind of filter, any kind of commentary. And I remember when that happened for me, it was such a feeling of like liberation from this tyranny of thought, of the mind, and that my body actually, I recovered it as a kind of safe space,
Hmm.
which was like started me off on this whole journey of like, oh my God, this body is actually wonderful. Like it's like what John Mayer says, the body is a wonderland, but not like your body is a wonderland for me, but my body is a wonderland. And
Yeah,
this world of phenomenological sensation, like direct sensing, is it's wonderful. I don't know any other
sure.
better word to put it, but just that getting out of the head and into the body was
Mm,
remarkable. But then, of course, it revealed a lot of stuff, like a lot of the
yeah.
kind of held tension patterns that I'd been carrying around for so long. And then it kind of started this whole other layer of somatic work to unravel some of that. But that first initial, like descending into the body and feeling that as a kind of freedom was a revelation.
Mm, sure, yeah. I guess like when you start working in that way, it's very difficult to hold your attention, as I said before, to be in your body at all. And it can often not feel like freedom. It can actually feel like you're like, especially if you've been through difficult things when you were much younger, like it can
Yeah.
sometimes feel like you're trapped to sink into your bodily sensations. And I think we don't, I certainly wasn't, as I grew up, I wasn't given any skills in how to do that. I had to go looking for
No.
those. And I was
Yes.
in my 30s before I discovered them, and actually they're
Yeah.
so profound and so useful and so sacred, like that these ways of working that I had to learn, but certainly I was not offered them um, by mainstream therapy and mainstream psychiatry.
Mhm. Yeah. Yeah, it's definitely, we don't get the user manual for the human body when we grow up in this culture. Other cultures,
No.
yes. They've got whole
Hmm.
systems where you learn about the body and your energy system and, um, the kind of like secondary importance of the mind and how the mind can actually get in the way of you experiencing reality and joy and things like that. But in
Yeah,
our
yeah.
culture, it's like, we gotta have some kind of like, the suffering's gotta get bad enough that we get so sick of being sick and tired or whatever, that we have this wake up call and we start to like go, wait a minute, I gotta like sort this out because I can't keep going
Yeah.
on like this.
Yeah. Well, I mean, we used to call it a nervous breakdown. That kind of that phrase kind of went out of fashion, but that implicit in that phrase was like, okay, this is like just someone who has to check out because life has got too much.
Mm.
Um, yeah.
Hmm. So you got this like taste of freedom, taste of
Yeah.
possibility,
Yeah.
and then you thought, well, okay, well, like if that's what's possible sitting here on a
Yeah.
cushion,
Yeah.
let me check out this other stuff,
Hmm.
psychedelics.
Yeah. Yeah, it was an interesting gateway really because like as you say, taste is the right word. It was a tiny glimmer, like, just over an hour and a half in like a decade and a half of very, very poor quality of life. So but like, it was enough. I was like, well, if the way I describe it in the book is like there's a version of me that is possible where like I'm not like hampered by intrusive thoughts.
Yeah.
That's, yeah, it gave me a sense that I didn't have to be trapped forever. And that was novel for me. And where I went next was like so I guess I kind of went home and like just started like essentially like obsessively, sometimes being obsessive can be a good thing. I just started obsessively reading, obsessively Googling around, like, what the fuck was that altered state of consciousness? Can you trip sober? Like, can you trip off the chemicals in your own body? Has anyone else felt like this? And then like obviously I sort of quickly learned that actually it's fairly commonly reported in like in meditation circles. Like it's not an everyday occurrence necessarily, but like it's not, I don't think if you went to like a someone who'd been practicing Buddhist meditation for 30 years and described that experience, they barely blink. It's like
Yeah. You go,
they
oh, yes, no mind.
yeah,
Isn't that
sure,
nice?
exactly. Yeah, yeah, exactly. So that all this was like it's just astonishing to me. But like one of the things that came up in that reading was that like that there'd been studies which had examined like they put like experienced like meditators in brain scanners, and that neuroscientists were sort of hypothesizing that there might be similarities between the brain states of experienced meditators and the brain states of people on psychedelics. So I was like,
Yeah.
that's my way in. That's my way in. And
There,
then
here we are with the brain scans again. Why
I
does it
know, well,
always?
yeah, it's exactly like it's just like I was so like that was just like my default like way of like
Right.
navigating the material.
Well, that's, I
And that,
mean,
yeah,
that's in the culture. I mean, it's always they're always pointing, some guy's doing a big TED talk and there's like a big brain scan behind him. You see here in the frontal cortex,
yeah,
here's what's
yeah,
going on. The meditator's in
yeah,
an alpha state or whatever. But it's why do we always
sure.
have to have these
I
brain
know,
scans? There's something we're so
sure.
obsessed with the brain, with the mind, and
Mm,
with matter in this culture that if we don't
sure,
have like a visual display of it, we don't take it as real or valid or
sure.
something.
Totally. And like it was seeing it in that scientific context, I guess, kind of gave it a sense of legitimacy for me. Like that's what I needed at that stage.
Hmm.
Like, this is like before I had like gone on the crazy journey that I went to go on. But for me, I was like, okay, this is the thing, this is official thing. Like they've been scanning people's brains, like I'm
Right.
in.
So you
And
find this correlation, okay,
yeah.
similar states via psychedelics. Okay, so it's a way to kind of get back there. Is that what you're thinking?
Yeah, I was like, I need to, whatever that was, I need to find out more about
More
that.
and experience more
Yeah.
of that, please. This
Yeah, I want more
vacation
of that and less of this, less of me and more of whatever the hell that was.
or that
So,
version of you that you experience, like more of her, right?
sure, yeah, exactly. Yeah, more of the kind of expansive universal love, please. That would be
Yeah.
nice. Um, and yeah, and then that's sort of what got me curious about psychedelics. And like, I I think, in some ways I'm quite risk averse. In other ways I'm very risk averse. I'm trying to get my sentence right. Risk averse and then risk taking. That's right. Sometimes I'm risk averse. Sometimes I'm willing to take risks. And but when it came to psychedelics, I was really scared and really averse because I'd read all the stories about how they can fuck you
Yeah.
up. And
Or you can get trapped in, some of those violent, intrusive thought. You can become like trapped in your mind, which is, to me was always the most terrifying thing.
totally, yeah. And the big fear for me is that like if I take one of these drugs, that it's just going to exacerbate, it's going to
Hmm.
bring up to the surface all the shit that I've been compulsively trying to like stuff down. um which of course in some ways they did. But yeah, I it took me, all of this is to say that it took me over a year of like tiptoeing up to the idea of doing a trip and like speaking to people and like doing a lot of reading before I felt like I could do that. And when I did it, I made, I think I made every mistake in the book, which is part of the reason why I wanted to go on and write about it, because like I didn't know what I was doing. And I was getting swept up in like what you describe as traumadelic culture, and just trying desperately to access this drug so that I could hack, carrying on the same paradigm that I'd always lived in, so that I could like cure myself, and
Yeah,
I
get
could
to the root cause that's going to explain everything.
sure, yeah, get to the simple solution. So I'd sort of was slowly kind of moving away from the idea that I had a disease, but then kind of tiptoeing towards this idea that I had trauma, but then like, which in many ways was a more helpful construct, but also potentially quite limiting as well. And I'd kind of
Mm,
replace one set of language for another set of language. But
yeah,
actually, my MO was still the same. It's like, it wasn't like I'm going to take an antidepressant and feel better. It's like I'm going to take a psychedelic and feel better.
right.
So in many ways, I was repeating a lot of the same mistakes. But this time I was doing it with, in much more risky situations, because I was taking psychedelics and not really understanding anything about psychedelic culture, and like how to keep myself safe. So I took a punt on like a random like psychedelic guide in Amsterdam that I'd never
I,
met.
yes, please. I wanted to ask you about this because
Yeah.
Like one of the things I really enjoy about your perspective is that you're willing to tell these kind of more embarrassing stories. Not that you should be embarrassed or anything like that, but like a lot of people when they're doing the kind of the trip memoir or talking about their healing journey, it's they're talking about maybe like the hell trip they took, but they made it through and they learned something from it, or they had this
Mm,
wonderful experience of love and light. But like the kind of banal, ridiculous details of that MDMA experience that you write about in Amsterdam, like with these facilitators who are just kind of
mhm.
wacky and strange. I mean,
Yeah,
please talk a little bit about that because I think it's really important that people understand like that when it comes to finding a facilitator or gaining access to
yeah.
some of these substances, it can be just it's the Wild West.
It's the Wild West, yeah. And it was magic truffles that I did on that trip in
Oh, okay.
Amsterdam. And I just didn't the thing is like I've sort of come to learn that like psychedelics are probably like best and like most safely taken when like you feel like you're like embedded in like in safety and embedded in like cultural references that are personally meaningful to you, and that you sort of that you're familiar with and that you can navigate and that you can use to help you. And like, I was there in a completely different country on a kind of, had to get out of London because it's not legal to do it in London, so that's like a pariah's journey from the get-go. And then, I'm like, you know, grew up in like a financially deprived part of the English Midlands, and I'm here in the middle of Amsterdam with these two white women from California who are like speaking in very breathy voices, and whose living room is like full of like all these different, like a kind of mishmash of like Eastern iconography.
Yeah,
And
spiritual
I'm
tchotchkes.
spiritual tchotchkes, and like they're telling I'm eating these truffles, not having any idea how much I'm taking. In the end, I think I took the equivalent of around, a 5 gram journey, tons. And they're like offering me like um oracle cards to pick with like spirit animals on them. And you know what? This isn't about like judgment. It's like I think like I really respect everyone's like spiritual system and like way of like navigating symbols that are helpful to them. It's
Yeah.
just that it was meaningless and tacky to me. And it
Hmm.
so therefore it was like discordant, like going in. And like I had no clue this was my first trip. So I was just like, "Oh, okay."
Yeah,
I
this is
guess
how it
like
goes, I
the
guess.
I guess
Pick
the
an oracle
owl.
card and
Sure. The yeah, I picked the owl, and she was like, yeah, the owl. This is a good sign. The owl is going to be your guiding your guiding light throughout this experience. And they were kind in many ways, and like I, again, like that sort of, as the sort of in quotes patient, like you want to like devote yourself to whatever's been offered therapeutically. So I was like, let's go for it. And it ended up being quite a badly facilitated experience, like that I write about in some detail in the book, whereby you know I, I had no idea what to expect. I took a high dose. I think I looking back, I wouldn't have started in that way at all. I wouldn't have taken as much. I wouldn't have started with that plant medicine. But anyway, I'm there. I'm like on a very high dose of magic truffles. And, I was left alone at the peak part of the experience. It was extremely distressing. Um, and yet I came away like the sort of I was, so in the trip, I was absolutely blindsided by the intensity and the clarity of the autobiographical material that came up for me. Um, I had this vision, if you can excuse me indulging in a very short trip report. I had this vision of uh, my mom, the sort of essence of my mother getting like sucked into a giant whirlpool in the sky, while me there as a child was like screaming at the sky saying, you can't leave me, you can't leave me, you can't leave me with this pain in my chest, you can't leave me with this pain in my chest. I woke up from that deepest part of the trip, back like banging my fists against my ears because the guides weren't in the room. Um, and I was terrified. Anyway, I was able, they came back in, they soothed me. It sort of, it got better. But when I came round, I went back to the UK and I thought about that experience. For me, it was like the first time that I'd ever come face to face with the theme that had always been too painful for me to think about, which was like, uh, being raised by a mom who herself had been given a diagnosis of bipolar disorder and who throughout my childhood had been in and out of psychiatric hospital, and who I had seen climbing the walls in despair and heard like sobbing at night. So, this, and in retrospect, I always knew that like that distress was like at the heart of like my mental health problems. You can call it OCD, you can call it intrusive thoughts, but that trip was the first time I ever like got in contact, felt like I kind of got in contact with like the source of the pain and actually
Mm.
like felt it. And you know to the what we were discussing earlier about like trauma being sometimes being itself quite a narrow lens, I think it can be. um and there was a lot more complexity to it than that, but that was really kind of the first time that at that point, like, it kind of blew the doors off the idea that I had an illness. I was like, fuck, there's nothing wrong with me, I just grew up terrified because I thought my mom was going to die. So
Mhm.
that was, even though I don't think it was a very well facilitated experience, the power of the drugs got me somewhere where I hadn't been before.
Mhm. Yeah. And I would say like from my perspective, this kind of soul-oriented perspective, um, Carl Jung said image is psyche, and the psyche is always feeding us these images. And I think like in the modern world, we're so inundated with images that are created by advertisers and media and everything else that we don't often leave enough space to observe the images that our psyche is creating for us, not just while we dream, but all day long. And one of the things that I think about psychedelics is that they bring those more directly to us by kind of getting the mind out of the way. Um, and so, like your psyche giving you this image of your mom being sucked up into this whirlpool vortex. I mean, not that it's even about death, but even her mental illness being imaged as this
Mm.
whirlpool, this swirl that's going to take her away from you is
Hmm.
just nobody could make that image for you. Like it was tailor
Yeah.
made for you to kind of get it and to see it, right?
Yeah. That's exactly it, which kind of ties in with what we were talking about before about kind of like the importance of symbols and like why it's so right that you kind of feel culturally attuned and safe in these experiences, is because like actually as you say, when you get your mind out the way, like it's not about like pulling oracle cards. It's like that work is going to be done for you.
Yeah, yeah. Your psyche's
At
got an oracle
yeah.
card ready to go, and it's like a
Yeah,
whirlpool.
sure.
It's yeah.
Yeah, exactly.
Mm.
Um, yeah.
That's a really good point in terms of like what kind of facilitation to look for is
Mm.
from my perspective, and I think what you're saying affirms this, is that the facilitator, like a lot of ways, just stay out of the way. Give space for the person's psyche to reveal things to them in its own way. And one of my problems with the whole trauma narrative is that it primes people, it sets them up to kind of go looking for that childhood experience
Yeah.
that's going to explain their adult problems.
Hmm.
And again, that kind of limits your view and maybe cuts you off from all this other stuff that your psyche's trying to take the opportunity to reveal to you.
Yeah, exactly. It's, I think what, so looking back at like, that was the first of like many experiences that I did and wrote about. And also since I finished the book, I've also done ayahuasca, which was a whole other kettle of fish. But like looking back, like I wasn't sort of aware of this in like 2017, 2018, 2019, when I was like first experimenting with altered states of consciousness. But like looking back, I think the advice that I would give myself is to try and like let go of any expectations of like let go of any framing, that any assumed understanding of like the nature of your problem. Because like one sort of defining feature of my psychedelic experiences is that they're surprising, and that like they sort of often served to like undermine my assumptions rather than confirm them. And I think like why this phrase traumadelic that you coined is like so helpful is that like it captures so much about like I think the kind of the way that sort of like budding psychonauts are like channeled into this like way of understanding their suffering. And to some extent the trauma framework can be helpful, but it's obviously it's not the whole story of someone's internal life.
Yeah. Well, I really like that about the way that you frame things in the book. And you're a storyteller. You write screenplays for successful TV shows and things like, and you write memoirs. You tell your story. But I like how the importance that you place on the stories we tell ourselves and how much that alters our perception and our experience of things. I find that to be so true, and I think like one of the things about the trauma narrative, it's just part of hopefully a bigger story. And what all I'm trying to do is get
Yeah.
people to question that
Mhm.
particular model and the kind of the reductiveness around it and all of that,
Mhm.
the surety around it, and just
Mhm.
see their traumatic experience as part of a larger story. And I think when
Yeah.
you put it in a larger context, it doesn't like minimize the experience itself, but it somehow it makes it less powerful or less all-consuming because it's in a larger
Mhm.
context. It's more
Mhm.
complex and nuanced. But
Sure.
it's about the
Yeah.
story we tell ourselves, exactly.
It is about the story we tell ourselves, and I think that's for me that's why it was helpful that like I stumbled into all of this through Buddhist meditation, because like um
Hmm.
in Buddhism, like you're constantly you're trained to like hold ideas very lightly,
Mhm.
and to like uh not continually reinforce the solidity of like your assumptions, but that you've kind of focused on the ephemera and the passing away of things. And I think that was quite helpful for me, like gaining these insights around like oh, I suffered because like my relationship with my mom was strained because of her agony. Well, yes, but also that's not the whole story. And as I continue to do psychedelic work, it sort of that broadened out for me, and and my healing kind of like resisted any kind of simple interpretation. Like I still don't really understand what I went through, and I don't really understand how I'm so much better. And like all I can really do is just like be humble in the face of like the mystery of the process. Um,
Mm.
but yeah, and like my mom's distress can also only be understood in a much broader context of like financial adversity, and like she was raised in the aftermath of the Second World War by a former POW, her father. So it's like all of this stuff is like so deep and so rich, and like you actually can't like it doesn't stay still long enough for you to grasp it. And I think
Yeah,
like
you
that
can't pin it down.
you can't pin it down.
Mhm.
um and it's beautiful, like it's actually, and if you stop trying, it's actually very, very beautiful.
Yeah. Yeah, and part of that, I think, it's one of the things I talk about sometimes. Like I interviewed the Jungian psychologist James Hollis. And one of the things, he's got a really kind of nice way of succinctly summing things up. So one of the ways he talks about like what a mature ego is that mature ego is able to tolerate the three A's: ambiguity, anxiety, and ambivalence.
Mm.
And I mean, that sounds very Buddhist from one perspective, right? Like
Sure,
to be
yeah.
able to tolerate not knowing, to tolerate uncertainty. And so much of our therapies, like we've been talking about, whether it's the biomedical model of diagnosis and treatment or the kind of the prevalent trauma models, they're all about like coming to a certainty of like cause and effect. Uh, and
Hmm.
that's somehow supposed to relieve the anxiety. But if we can learn to tolerate the
Hmm.
ambiguity and uncertainty, that to me is like about expansion. rather than like contraction to one single point or one single cause. And
Totally.
that to me is like freedom. Like, I love this thing that Jung said. He's like, look, it's not so much that we solve the problems, right? We don't solve the mystery of like, why am I like this? It's that we
Mm,
outgrow the problems, and we do that
yeah,
through like developing our capacity, through like having these varied experiences and expanding experiences. And that to me
yeah,
is like when we talk about psychedelics, like that's what's happening, but that's not the story that we're being told about how they work. We're being told that they change the brain or they help us to whatever heal childhood trauma means. I don't know what the hell that means. I think all we do is take our childhood trauma and we put it in a bigger context. And that
yeah,
feels like healing or something because we're allowed to hold it. We're allowed to be whole again.
yeah, yeah, totally. I mean, yeah, I think I keep coming back to a sense of awe about the healing process.
Mm.
And like I think, it's natural that we try to come up with models to like make sense of it. But I think the problem is that the way we generally approach mental health problems is that um, these models are not signposted as models, as like as maps of reality. They're given to us as like reality itself.
Yeah.
And in in meditation, like we talk about ways of seeing. So I think trauma is one way of seeing your problem. I think that what's at the biological level of analysis, what's happening in your brain, that's one way of seeing your problem. um I think there's a whole much broader like social context that we can look at, like the misery that so many of us are in.
Oh
So
yeah.
and I think rather than like trying to like oust or like push any one of those like maps off the table, it's just like let's just like hold them all lightly and use them to the extent that they're helpful to like arrive at wholeness. But of course, like that's not how things tend to work in an industry. In an
Yeah.
industry, people tend to like hammer home like one specific way of doing things because that's the thing that they're known for, or they get prestige for, or notoriety for, or money for. And the more that happens, the more narrow that way of seeing can become. And I think we see that like all over the mental health conversation, the trauma conversation, the psychedelic conversation, and it's exhausting.
Yeah. And I think ultimately like disempowering. Yeah, in your book you write about like so as a writer you've worked in marketing,
Hmm.
right? And my
Yeah.
my previous life, up until my mid 30s, I worked in advertising as a designer and copywriter, and so we know kind of like how these things work on the inside and like how much it is about like distilling things down to that
Hmm.
one message that has in it a kind of a promise and a call to action. And one of the things that you point out is like this is what's happening in the mental health field as well, not just
Hmm.
the psychopharmaceutical industry, but mental
Hmm.
health, which you would think is like kind of only benign and good, kind of these governmental health programs that we have here in Canada and you have in the UK. But a lot of it, what it comes down to is just like kind of good marketing that's going to grab people's attention and kind of draw them in to that particular narrative or viewpoint, right? In order to what? Sell them something.
Yeah, totally. I mean, it boils down to messaging and the way that stories are like shaped and sold. And I
Hmm.
think in the mental health advocacy space, like uh, our mental health landscape is quite different to in the US. And I actually don't know much about public mental health in Canada. What's the situation? Do people have to get insurance to like get access to mental health care? Is it free, or where, how does
We're,
that work?
we're very much like the UK model here.
Okay, cool.
Yeah,
So
although
like,
like you don't have to pay for it up front usually, for most
mhm.
things. Um, there's like long lineups, there's a shortage of doctors, so it can be hard to get care. But once you get in the door, it's paid for the most part.
Okay, yeah. So like the situation in the UK and in Canada is slightly different than to the situation
Yeah.
in the US.
It's not
But
all
like yeah,
privatized. Like
sure.
we don't have any drug advertising here and things. So when I go to the
Okay,
States
yeah.
on a trip, I'm like, "Oh my God, it's like every commercial is about a different drug." Like it's really
Yeah.
eye-opening.
It's nuts. Yeah, it's shocking actually. When you're not
Yeah.
part of that kind of culture, it's really shocking. Um, yeah, so I think like in places like the UK and Canada, like the public health messages around like mental health, like generally they're like well intentioned, but it's just that they can sometimes like be, in my opinion, quite harmful. In the 90s and noughties in the UK, there was a sort of there was a push to frame mental health problems as illnesses like any other, as I said earlier, and there were very popular government-funded campaigns that specifically advanced that way of seeing. Um, Slogans which popularized the idea that 1 in 4 people in the world has a mental illness, this kind of thing. Um, and I think, yeah, that they came from a good place. They came because like those people who commissioned those campaigns thought that it was going to help and thought that it was going to work. I think we're not like our psych industry is not captured in the work by, like, for example, as you say, pharmaceutical interests in the way that things are in the States. So I think simple stories don't always mean like bad incentives or bad intentions. It's just that that's kind of how markets work, and that's kind of how comms work, as like you and I know, having worked in comms. It's just that you know you're always trying to find this the simpler distillation of an idea. And we're moving away from that now. I think with the rise of social media, that those very simple narratives around like the biomedical causes of mental health problems seem to be rescinding to some extent, I think. But
Well,
yeah,
oh gosh, I would say like it's being replaced by trauma as
yeah,
the universal explanation. Like, man, I see ads on social media that ascribe everything from procrastination to PTSD to childhood
sure, it's
trauma.
mad. Yeah,
It's like procrastination or procrastinate, that's a trauma response. Like, what the hell?
it's mad. Yeah,
It's
it's
out of
really mad.
control. Yeah, so I feel like in some
It's out
ways
of
we've just
control.
like replaced this other model with the old model. And I'm wondering like,
Totally.
so obviously, like you've kind of run into that, and we see like how that's helped to expand the conversation, and it's really good to destigmatize trauma and allow us to talk about it and to recognize, that things that maybe were normalized in our family or culture that we experienced when we were young were actually harmful to us. And so then we can start to change the way that we raise kids and we allow kids to talk about things at schools and all of that stuff has been really great. But it's like what always happens in our culture is like the pendulum goes too far in one way. We become
Hmm.
one-sided in another direction. So at first
Hmm.
there's like a kind of a balancing that happens, but then we get stuck in the one-sidedness. And so I'm wondering, like, what do you think like the next steps are? I think like what you're talking about in terms of story, that could be one direction, like the whole like,
Hmm.
approach of like narrative therapy, or what I've been advocating for is more of a depth psychological perspective, which is really
Hmm.
about giving us a bigger context for our suffering and healing. What do you think though at
Yeah.
this point?
Well, I mean, I haven't solved that problem. I have given it a lot of thought.
Yeah.
Um, I think um, I think things like narrative therapy can be super helpful. I think I really do have a great faith in the power of relationship and community. And I think um, I'd like to see a much greater investment in community life. And I think if people are held within community and they feel like they have purposeful lives and that they have somewhere to go and that people are thinking of them, then a lot of this other therapeutic work kind of has its own like self-organizing energy. And that uh we sort of, I feel like we innately understand story and we innately understand culture, but we're living apart from each other because of a thousand factors. But I just think yes, like an emphasis on the value of, for example, psychotherapy, different kind of therapies is potentially helpful. But also, I actually think that like if we built a better society that where there was more equity and more meaning, then actually we wouldn't need therapy like we need it. So
Yeah,
you
totally.
know,
Yeah.
yeah. Um, so I think I'd like to see more an emphasis on like a relational way of understanding our suffering and relational ways out of suffering.
Hmm. Yeah. As you're talking, I can't help but hear the Iron Lady Margaret Thatcher say, there is no such thing as society, there is only the individual. And I think
Yeah.
like a lot of our therapies are come out of that, neoliberal movement toward the isolation of the individual and being like self-sufficient and
Totally.
pulling up your bootstraps. And like we hear it in healing culture, got to do the
Hmm.
work. I go, oh my God,
Hmm.
you know what you're shouting
Yeah.
at other people is like more work for them to take on
I
themselves.
know. We've done enough.
And maybe that's part of the problem is like why people are feeling so overwhelmed and
Mm,
isolated and like despairing. Like, oh my God, I gotta like dig up all this stuff and like just try to get by in the world and there's so much pressure on me financially and it's like more work to do. And then when you're done your
more
personal
work.
healing work, then you do your ancestral healing work and
Yeah.
meanwhile the culture's still going to hell.
Yeah. The to-do list never ends. Um,
But I think like what you're
yeah.
right is like like a big part of it, I think, is that taking the focus from the individual and focusing more on community. Like if we look at indigenous models of healing, there is no such thing as an isolated individual who's sick.
Hmm.
There's a member of a community who's
Yeah.
ill, and that's a reflection of something going on in the community, not in the individual. They just are expressing something that's going on in the
Yeah.
community, and so it's a
Hmm.
community project to do some healing
Yeah.
work, to do some ritual around that. And
Totally.
one of the things that I think is so helpful about some of the psychedelic experiences we have is we're these, neoliberal, Anglo, North Americans and, who are so disconnected from community and ritual and rich stories. But then we have this experience that is so full of that feeling of communitas, of like magic and
Hmm.
beauty in a lot of
Hmm.
cases. And I started to see that as really the kind of the healing factor, not necessarily the kind of the memories that surface or even the insights, but like all of those other things that can be a component of these psychedelic rituals or ceremonies.
Totally. And, those experiences of communitas, you can access those without psychedelics too. That's not something that you're typically going to hear from psychedelics researchers because like their MO is to research and promote psychedelics. But like actually, um, the most valuable thing I took away from my psychedelic work is that like essentially connectivity and like I can seek out those relationships in other ways that actually don't involve the psychological risks of psychedelics, which are undeniably there. So yeah.
Hmm. Yeah.
Yeah, and it's
Uh,
it just
say it. What?
I was just that you mentioned Margaret Thatcher, which sort of a slightly full circle moment for me because I see sort of my distress and over the years as sort of being intimately involved with Thatcher's policies because like my mom's profound depression was in part a response to the fact that my dad was made redundant by Thatcher's privatizations initiatives in the Midlands in the early 90s. So I think one of the biggest criticisms and one of the most compelling criticisms of uh, traumadelic culture is that it's, as you said, it sees trauma as like an individual centered event when actually it's not. As you said, in indigenous cultures there's no such thing. It's like an individual, it doesn't make sense out of context of everything else that's happening within the community. um yeah.
Mm.
Which is, you know, and when you keep talking, it sort of all boils down to those same like banalities that everyone comes away from psychedelic experiences with, that like everything's connected, but like, you know, there's a lot of truth in these cliches.
Yeah, and I think like it matters a lot what you do with that insight. Like a lot of people have that insight, like you said. It's like become a cliche, like, oh, it's all one, man. It's all connected. Um, but then how is that insight functioning in your life? How are
Mm.
you living that out? Because if you
Hmm.
go back just to the way it was, you know, you continue, now I'm doing my integration work based on the thing and all of that. Um, you're not going to get there in terms of making that your way of life or recovering something in the culture. Um, so that's like the big piece of the puzzle for me. And I think, like you said, even when it's happening in psychedelic circles, it's still like kind of a privileged class thing, and it's not totally accessible to everyone, and it's not appropriate for everyone. And so if we can focus on like what the real the healing factors are, psychedelics can be a part of it, the substance can be a part of it,
Hmm.
but it's all of these other things too. And then we can like kind of extract those things and go, okay, well, communitas. What does communitas involve? Well, it's about me kind of leaving my personal identity at the door and entering into a space where there's like it's a space of total equality and humility and shared experience, non-hierarchical. That's one of the beautiful things about communitas. So how else can we foster that? So something as like kind of simple as like a community choir that meets every week
Totally.
can get you that feeling of communitas, like your voice getting melded in with the group voice. Like that is a feeling of communitas.
Hmm.
Sweat lodge, but maybe it's not like a kind of co-opting indigenous style sweat lodge, but maybe like a communal sauna experience.
Yeah,
You
totally.
know, where
Yeah,
people are going and being quiet together and enduring something and.
yeah, yeah, totally. And you know, I think like I'm all on board for like there's this weird phrase in the UK, people talk about like social prescriptions, the idea that a doctor would give these social prescriptions,
Hmm.
which is kind of a sort of a clash of paradigms, because actually what we're talking about, if like we lived and we did the kind of things we're talking about, the kind of the doctor and the therapist role in someone's mental health would be actually much smaller. And
Yeah.
the systemic change would involve like every researcher perhaps accepting that their research and that the thing that they're promoting might not be the most important thing in someone's life, but actually it's about, as you say, it's about community and it's about belonging and it's about relationship. um, but it might not be about any one specific protocol or any one specific worldview. um,
Hmm.
yeah.
Hmm. Yeah, and if we could somehow get funding for those kind of things, you know.
Yeah, I know, how do we do that?
Well, we can advocate for it, you know.
Yeah, we can advocate for it.
We can start like trying to bring in different stories or bigger stories.
Hmm.
Um, Yeah, I think doing what we're doing is talking about it and asking questions, daring to question the received wisdom. Like
Totally.
when I started talking about the traumadelic stuff a few years ago, man, like people were responding to me like, well, like I was taking away a part of their identity, that same
Mm.
level of defensiveness. Like
Hmm.
kind of like, how dare you question this
Yeah.
story that I'm telling myself? How dare you question the authority that I have put on a pedestal and look to and admire so much? Um, so it was like a bit risky. But I think
Yeah.
like what I've seen, like since I put out the book late last year and I've been having more conversations about it, I'm getting a lot more kind of interest in people saying things like, I'm glad you're talking about this because now they've had a few years maybe in healing culture and seen like where
Hmm.
some of the limitations are, where they've been limited
Yeah.
on their own healing journey.
Yeah.
So there's a little more receptivity I'm seeing now and more interest, which I think is signaling a shift in the culture.
Yeah, I think there has to be. I mean, I think it's also worth remembering that like in the West, like we're so like new to this in terms of like building culture. Like we don't really have a psychedelic culture, and like that we're at the very like first stages of like creating that. And as part of that process, all of these different narratives can coexist and like compete with each other. But yeah, I guess it's tricky when prestige incentives come into play, and audience capture comes into play, and
Yeah.
financial incentives come into play. It's messy, but as you say, it's like it feels good to just sort of like sit down and have conversations about it.
Yeah, like you said, waffle on for a while, like without
Yeah,
thinking we're
God,
gonna
it's good to
fi
waffle on.
like we're gonna figure it out without the pressure to like come up with a solution, but just to yeah, have conversations about it. And yeah, even like, what one of my heroes, James Hillman, said, like the value of the empty protest. Even just to be able to say, like, I don't know what's wrong, but I know something's wrong. It doesn't feel right, and I don't know what the solution is. But
Mm,
I think that is undervalued, especially in media
yeah.
spaces where, we're talking heads and, maybe we're seen as experts or something, and we should have some ideas about how it should be. But like in my book, I'm just like, I'm kind of raising questions about all the received wisdom, and I'm like making some suggestions on how we might do things a little different. But I'm not giving a kind of a Jamie Wheel type prescription. Like, here's the 10-point
Yeah.
plan for psychedelic culture. It's like, come on, dude. Like, you're,
Yeah. I didn't know you were a James Hillman fan. That's cool. Yeah. I mean,
well, you quote him
that's
a couple
very,
times in the
very,
book. I was like, all
yeah, I
right,
do.
she's on to
Yeah.
him. That's great.
Yeah. But I mean, he's very skeptical of the trauma model. He's very skeptical of like the psychotherapy, full stop. No.
Yeah.
Yeah, he's great. I encourage everyone to read him. Yeah.
Yeah, me too. I'm always going on about him. Yeah, because I think like, he was seeing things that I saw. Like I think in a lot of ways he was prophetic, and he was deemed a heretic in the kind of the Jungian and the more conventional psychotherapy worlds. But what he said, he's like, well, I'm doing a therapy on ideas. And I think it's
Mm,
important for there to be people in the culture who are kind of outsiders, who are taking a look at things and offering different perspectives and challenging all the received wisdom. Like, especially now with uh, all the podcasts and the YouTube and everything. People can get
yeah.
elevated to such a high status just by virtue
Mm,
of the fact that they get, the zeitgeist kind of grabs onto them, and all of a sudden they're everywhere. They're on, Gabor Mate and like 1,000 videos on YouTube. And it's
wow.
like,
Yeah, it's mad.
if that's like the main voice you're hearing, well, it's going to lend it a kind of authority. It's like, well, he must know what he's talking about. He's everywhere.
Yeah, exactly. And then it becomes very difficult to sort of question those narratives because it's just sort of you get that kind of blanket coverage effect.
Mm,
Um, it's something I think we've all got to look out for as like people who like speak in public on these issues is like that risk of audience capture and that kind of, there's the, you know, yeah, of getting of having your point of view like funneled by like what people want to hear rather than but why by what you actually think or what you think you're supposed to say. It's a challenge. And
right.
I don't know. I think for me, it's helpful that like I don't. This is not. I don't have a dog in this fight professionally. Like it's not what I do. Like
Yeah.
I'm like very much outside. I'm a screenwriter, and I'm not offering a service. It's just like here, I'm offering my opinions and my experiences. So it's kind of helpful to sort of be outside looking in rather than yeah
Yeah,
in the
I mean
trenches.
that's a great point, and I think that's why I appreciate your writing is because you don't have a dog in the fight. You're not invested in promoting a particular thing and feeling locked into that because of whatever the programs that you've developed or the organization that you've built around this central idea. Which
Mm,
can make it like if you understand someone like Gabor Mate or Bessel van der Kolk or Peter Levine, people who have built these like empires around a
mhm.
central idea,
Yeah.
how impossible it would be for them to question that idea, to alter it in any way, right? Like so
Yeah,
much is
totally.
invested in it, and there's so many other people like in that pyramid scheme who are invested in it, all the coaches and trainers, and I mean, gosh.
Totally. Yeah. Yeah, because it then becomes almost impossible to like walk back
How could
your
you?
ideas
You'd have
then.
to
Yeah.
tear down the whole thing.
Yeah, exactly. But it's fun to tear down your assumptions sometimes, on a much,
For
much,
people
much.
like us, like, outsiders, or, for me, just as a solo, practitioner, you
Yeah,
can do
I
that.
guess it helps when you don't have like millions of dollars or millions of pounds like riding on a reputation. Like it's very easy to kind of like publicly renege, and to sort of publicly like scrutinize your own work. But yeah, if it's been the making of you, I think that's something different.
Yeah. Well, just
Yeah.
maybe for something for people to consider, in who
Hmm.
they're seeing as an authority. Like, really take a
Yeah.
look at what they're doing, look at the business of it. And,
Yeah.
for me, it's part of my kind of punk rock Gen X thing. Like, I'm always skeptical of anyone who's pursuing fame and wealth
Mm-hmm.
to that
Mm-hmm.
degree where they're kind of like sacrificing their personal life in order to be out
Mm-hmm.
there all the time, flying
Mm-hmm.
around. And like that always me, I'm always a little skeptical of people like that. It's
Mm-hmm.
like because I don't want to be that famous, and I don't want that kind of
Mm-hmm.
wealth. It brings with it too much complication and responsibility and drama, and
Mm-hmm.
takes away my freedom to be a free thinker.
Mm-hmm. Yeah, and I've interviewed like some of these very well-known people in the trauma space, and like I think there's a huge amount of value in the output, but I also what I see there is exactly the same credulity that I've seen from psychiatrists since I first walked into a doctor's office when I was a teenager. It's just that like I can help you, I understand you, and I think the trauma narrative just it gives professionals the illusion of understanding the person in front of them, and that can be deeply, deeply harmful in very, very subtle ways, especially if it's over the course of someone's journey over a decade and a half through the mental health system. So I think what I'm getting from you, and I can't wait to read your book, is this combination of skepticism but also idealism and optimism, and I think
Mm.
that's really, really important. It's just like question the stories that you're told about yourself, and always like retain that sense of personal freedom to make up your own mind about what you think your suffering means, because actually nobody else can tell you that, and that takes the deepest work, and it can take a long time.
It will take a long time. It may take a
Hmm.
lifetime.
Yeah.
So, like, also, like, if you can not see it as work, like the way I put it is soul work. I'm at least trying to bring soul into it because for me, like, soul work is about all of the things that add like richness and meaning to our life. It's not it's
Hmm.
not this dark descent into the past to only look at the pain. Like, one of the most healing MDMA experiences I had, my wife and I, once I kind of left the advertising career, kind of blew up that life, and was it before we started our new life, we were traveling around in a Volkswagen van, coast to coast in our giant country. And I don't know, I'd had my first ayahuasca experiences in the months previous, and so like all this stuff was getting brought up to the surface in me, like it was still ongoing.
Mm.
And so we're locked in a van together with our two dogs, going to these campsites and everything. And it was really stressful. Like a lot of stuff was coming up. And one night, a friend, before we left, a friend had given me some high quality MDMA and said, "Here, just for the journey, like you might want to take it at some point." And it just hit. It was like, okay, we need to like sit down and kind of recalibrate here, reconnect. So around a campfire, I took this MDMA, and instead of like going back into my childhood trauma and all of that, it was like I was recovering all of these memories of like the good friends I had when I was a kid, like I was a bit of an outsider, but there was always like at least one or two kids where we had found this real deep connection together in our outsiderness or our weirdness. I remember like one teacher who was like super supportive of my cartooning and my creativity,
Hmm.
Mr. Corvino, God bless you if you're out there. So I was like recovering all of these like really good memories. And that was like one of the most healing experiences I've ever had. And it had nothing to do with the
Mm.
descent into darkness.
Yeah.
And I feel like that helped me recover some soul.
Yeah, it can be light as well, you know.
Oh my God,
Um,
more light, please, or more
yeah,
joy, more
yeah,
goodness.
sure, sure. And sometimes you can get that message from mushrooms or ayahuasca that like, that feels like work. You don't have to do that. Like, you're okay. Just like you're okay. Just relax. You're fine. And like, sometimes I think if we sort of go in expecting it to be harrowing, and I think it's wise to have a certain level of preparedness for it being a very difficult experience. But certainly if we're going in expecting it to be horrendous, that also that can influence what comes up. So
Totally.
um, I think a good MO is to try and give these healing experiences a sort of an open future and a sort of a willingness to be surprised and yeah, go in with a beginner's mind.
Hmm. But imagine going into a psychedelic therapy session where they say, look, the focus of this session is going to be to recover some joyful experience that
Oh yeah,
you've lost. And
yeah,
because the culture, the healing culture, is always so focused on what went wrong and
yeah,
what's
yeah, yeah, yeah,
going
yeah,
wrong and all of that. And
yeah,
like, what if you went in there like, no, no, this one's going to be about like recovering some like nugget of joy from your youth. I
yeah,
mean, I don't hear that kind of thing, but like, why wouldn't that be healing?
yeah, exactly. And I think it's important to say you can be very like pleasantly surprised by these experiences as well. Just like just the ineffable joy that you can get. And yeah, that's not how I was schooled to frame
Mm.
my psychedelic experiences going in. But you know, there was yeah, a lot of silliness, a lot of funny stuff, a lot of lightness. Yeah.
It's been really great talking to you. So the new book is The Maps We Carry.
hmm
Have you started working on like another book, a follow-up to this one yet? Or are you waiting to see if something comes out of, you know, the
No, I
wall?
mean my current rate of writing books is like one a decade. So I feel like I maybe need a couple more years of fallow time to figure out what happens next. Um,
Yeah.
it's yeah, I mean I love writing books, but it just takes it out of you, as you know.
Well, I
I would
mean,
love to I
especially
would
when
love
they're
to read your book, by the way.
yeah, I'll send it to you. But like, especially
Yeah.
when they're based on your life experience, it's going to take some time to generate enough
Yeah.
experiences or like new insights or whatever, new perspective to write about. Like, yeah, I'm once every 5 years. After the second book, it's like I got 5 years worth of material in each book that I've written so far. So,
Yeah, there you go.
but
And
my
yeah, you
books
go.
are
And I was
smaller. So-
I also don't want to become like a compulsive memoirist. I think that's not a good
Okay.
direction for me. Like, we'll figure
Yeah.
it out.
Great. Well, it's been a real
Cool.
pleasure. Thanks a lot for spending
It's been
time with me.
lovely. Yeah, thank you. I feel like we could chat for hours, but
Yeah.
yeah, I'm sure we'll be in touch again in future and we'll do this again.
Yeah. Cheers. Take care, Rose.
Cheers. Cheers,
Bye.
Brian. Bye.